everybody, Dr. Brad Kobsar here. Welcome. Today, I'm going to be talking about the principles of wellness care. Lots of great stuff to cover today. Excited to get to it. So let's go ahead and jump in. What I'm going to be talking today, I'm going to be talking about a lot, actually. Homeostasis, heterostasis, allostasis. I'm going to be talking about vitalism and the concepts of materialism, sick care versus healthcare, and the hallmarks of wellness. So let's go ahead and start off with talking about homeostasis. So this is our natural kind of state of being, okay? The body tends towards healing, health, and equilibrium between a bunch of interdependent elements and systems and processes that are going on in our body. That's our biology, right? That's our metabolism, our hormones. And so when those things are functioning properly, our body it stays in a state of health. Okay, so if we have a homeostasis that it's maintained, it is able to adapt to our stress. And as we get healthy or stay healthy, this is our normal way of being. And so there is, though, other states of being, and those are heterostasis and allostasis. So I want to just looking at those three in comparison to each other. Homeostasis is really just surviving. Okay, it's not an optimal place to be. Okay, it's your basic biological functions: blood pressure, heart rate, temperature control, blood sugar stabilization, all of those kind of basic functions. But if we do lose homeostasis, that's when sickness and disease take hold. Heterostasis is kind of a step above. Now we're going into coping. So we are able to not only maintain those basic functions, but we're also able to cope with environmental kind of toxins. So, you know, whether it's some kind of something that we're eating in our food, maybe it's a actual physical stress, maybe it's toxins in the air, toxins in the water. It can be even emotional stress. Those things are our ability to cope with all of those things is if we're able to do that. Then the last and the most highest way of existing and living is called allostasis. And this is where we're thriving. And this is happening because through biological evolution, okay, in our cells and in our DNA, we've adapted to environmental stressors through our hormones, our immune system, and our nervous system. Okay, all of those are the three systems that kind of interact with the environment around us and allow our body to stay and maintain a state of health. And so there's two lenses to look at life. And I'm going to take you back to a couple of Greek philosophers here, Plato and Aristotle. Okay, one view is called vitalism. Another view is called materialism. Plato is known for vitalism, and there's a famous picture of Plato and Aristotle walking together where Plato is pointing at the heavens, and that's because of his belief in an ultimate truth, an ultimate intelligence. He's a vitalist. Okay, Aristotle, he in that same picture is gesturing towards the earth, representing his belief in knowledge through scientific observation and our physical experience. So that's his way of looking at the world. That's a materialist way of looking at the world, where all natural processes can be mechanically explained by the laws of physics and chemistry. Now, there's two types of materialists. So the true materialist, they reject any non-mechanistic or non-materialistic concept or process that cannot be scientifically proven. A pseudo or quasi-materialist acknowledges the existence of an unseen force, but denies that it has the ability to run the universe or your body. So this is long before something called quantum physics came into existence, which was first introduced by Lamarck in the 1800s, but was really made famous by Einstein and Tesla. So we'll go into that just a little bit, but just going back to materialists and in the age of the Renaissance. So that's back in the 1700s, long before either Einstein or Tesla. Western medical science began to divorce from vitalism. Okay, the scientific method it became the be all and end all, and everybody, any kind of concept, if that was introduced, if you couldn't scientifically demonstrate it, it was criticized for being unscientific, and we still see that today, and rightly so. Right? We don't want to ignore this process; it's important. But we got to have a marriage of both. Okay, they both can't just be one extreme or the other. So we need to look at both things. So looking at vitalism now, this is where we look at the processes of life that are not just explained by physics and chemistry. Life is in some part self-determined because life is more than just a set of chemical reactions. Vitalists acknowledge that there's a power greater than you and your physical matter. It emphasizes the supernatural, okay, the metaphysical, and that's where the two kind of separate. So with the materialists, they kind of were then stepped onto the shoulders of Newton, Sir Isaac Newton, and Democritus, and they were the mechanical physicists, right? Everything looks the same to everyone. That's their way of looking at things in the mechanical world, regardless of location and speed. It makes sense to us in our everyday life. And if I told you that a 1 meter ruler is a different length when I'm running, then you might think I'm nuts, right? Because you can't see it. And that's because it's only 0.00000000008 of a meter longer. So when you look at the Newton's assumption that the universe is the same for everyone, it's a logical assumption based on what we can perceive, but it is incorrect. Okay, and that was shown by Lamarck, who I mentioned earlier, and also Einstein and Tesla back in the early 1900s, where the discovery of quantum physics, which is the mathematical description of the duality of energy and matter and the laws that prove atoms are made of energy, right? They're mostly empty space, 99% empty space. These laws do not follow our laws of what we can perceive in our environment around us, what we see, what we feel, what we touch. So that chair that you're sitting on right now, on an atomic level, it does not exist. It's an illusion. So this is the part of science that it dares to go where linear thinking counterparts can't. Quantum physics is an invisible world. In short, though, everything is energy. Energy influences other energy, and energy appears out of thin air. What this means is that since we're all energy, we are all connected. Okay, matter does not separate us because we are not matter. Okay, you and I have a lot more in common than you think. And since we're all made of cells and atoms, quantum physics allows us to see our illusion of reality, which is pretty cool. So then what is true reality? Well, we are particles of energy or spirit with a proven ability to influence other energy, and we are therefore conscious. Okay, so our truth is our reality, and this is our consciousness. So there's a triune of life that everybody's heard before, body, mind, spirit, right? That we all are consist of. Spirit is always 100% perfect. It's kind of like a universal intelligence. Mind is more like the innate intelligence that runs your body function, and it is also 100% perfect. It is the link between the universe and our matter, our physical matter, which now is our body. Okay, and that's the expression of our innate intelligence through matter. Okay, you with me so far? So the universal intelligence is in all matter, and it provides all its properties and maintains its existence. Universal intelligence is intangible, so mechanical physicists or materialists, they can't demonstrate its existence. However, quantum physics does establish that it does exist. Our innate intelligence, okay, that's the intelligence of our body, or in what it equates to the mind, right? It reflects cellular interdependence, interrelationships, and communication throughout our body. Your DNA is when you get your DNA tested, it unlocks the code for your innate intelligence. So you can now uncover your, what I like to call divine nature awareness. So DNA, get it there? Everybody, anybody who knows me that I really like acronyms. So DNA in this case is divine nature awareness, not deoxynucleic ribonucleic acid. And reveals it reveals the blueprint for what your specific health needs are based on your DNA and your genetic code. Okay, let me talk a little bit about cells. Okay, so they are the first life forms, right? Since single-celled organisms, you know, remember those little parameciums that you remember in maybe middle school or even elementary school, looking at those under the microscope, and the amoebas, and what else was there? The flagellums. Anyways, yes, those single-celled organisms were the first forms that appeared 600 million years after Earth was created. And they ran the place. They ruled the planet for 2.75 billion years. They were bacteria, they were algae, they were those amoebas. Well, about 750 million years ago, those cells decided to get together and they formed communities. Okay, and when they formed communities, that now became plants, that became animals, and it became us, humans, right? So cell communities, a big reason they came together is so that they had an increased awareness of the environment around them and thus a better chance for survival. Then they also then became specialized. Those cells started to become, once they became part of a larger organism, cells started to specialize so that they could have specific functions. And this applies to every kind of community, and we actually see it as people. Okay, so you can almost think of cells as miniature humans. When you think about how our community works, our cities, our states, like we all specialize, right? We all have our different specific functions, and that contributes to the whole organism of the body of the people. So there's different levels of organizing in the body. Every cell should contain, it does maintain its individuality, and we should too. They act for their own welfare, but also for the greater community. This is where our higher purpose comes in. A greater authority governs this. Okay, it governs the cells. It governs us. If we listen to it, if we hear it, we got to be paying attention. Life is the expression of innate intelligence through matter. There's different levels of intelligence, right? And they're expressed at the cellular level, as tissues, as organs, as organ systems. And the limitations, though, of matter can happen, and they're caused by many factors. For example, if your nerve gets impinged, it blocks your nerve impulses. Also, nutritional deficiencies, physical trauma, psychological trauma, all of these things are where our limitations are met in our physical body. So our innate intelligence is limited by the limitations of our physical matter. So that leads me to talking about disease. Okay, disease is a state in which physical signs and symptoms appear, which are labeled or diagnosed for the purpose of treatment. Disease is a term meaning not having or a lack of ease. Okay, lack of coordination, lack of transmission, adaptation, lack of balance, lack of wellness, lack of thriving and health. Okay, so we want to eliminate disease so the body may fight off the disease effectively. So holistic doctors, if you know, a holistic doctor, what they are doing in their approach to health is to make sure that if there's make sure there's no broken links between the three parts of the triune. Okay, the body, mind, spirit. That's what a holistic doctor really is doing. Is they're looking at the whole person rather than just, you know, a specific system, you know, a nervous system or a cardiovascular system or a stomach system. They're looking at the whole body as a whole. And this is done by removing any interference to any of those systems and resolving and rebalancing the lack of ease or dis-ease in the body. Just want to talk a little bit now about our healthcare system here in America. Okay, where do we rank in the US, in the world? So this is from the World Health Organization. Well, we rank number one in expenditures. Okay, America comes out number one in the costs that we pay for our healthcare. However, our quality is only 37th, and our overall health of our nation is 72nd. That's out of 129 countries. Out of 129 industrialized countries, we come in 72nd. We come in 47th in terms of life expectancy at 78.14 years. And we come in 43rd at infant mortality. And that's down from in 1960, we were 12th, and 21st in 1990. So we're not getting a lot of bang for our buck here, right? We're spending the most. We're paying the most of any other country in the world, but our results are not coming. So let's look at some of the reasons why. This is a study that was done by Stanford's Barbara Stanfield. So she's an MD, she's a PhD up at Stanford, and she looked at the top 10 causes of death back in 2013. And this was published in the Journal of the American Medical Association, JAMA. And it was confirmed in another study later in the British Medical Journal. And they found that the third most common cause of death is medical errors. Okay, 251,000 per year back in 2013. That's 700 deaths per day from medical mistakes. So I'm not here to beat up on doctors. Okay, I don't want to blame doctors. They are part of a system, and they're actually handcuffed to that system. They have to follow the healthcare system. If they don't, they can lose their license, right? They can get reported. You know, if you didn't prescribe that medication, then you're going to be in trouble because your lab test said this, so you needed to do this. It kind of takes the decisions away from the doctors and puts it really into the system. And if they don't follow the standard of care, they are punished and they can lose their license. So I want to talk about three different types of care right now. We have crisis care, we have active care, and we have wellness care. Let's start with crisis care. So crisis care is where you have a disability, you have sickness, you have disease. You're dependent on medications, surgery, maybe some kind of care provider, whether it's a family member or you're in some kind of a nursing home, or somebody's coming to your house to help take care of you. And this is what leads to a lot of medical bankruptcies in our country. So because the costs are phenomenal. I mean, they're like we said, we're number one in the world in terms of costs. That's crisis care. Of course, that's one we want to avoid at all costs. Second type of care is active care. So this is where you're attending your doctor visits. Maybe you're going for physical therapy. Maybe you're going to see your chiropractor. Maybe you're seeing a counselor, or you have a health coach, going for massage, have a personal trainer. So these are all active care strategies where you're engaged and you're doing something, but really you're still kind of passive because something is being done for you, except for the case of the personal trainer. You're active with that. Wellness care is that's where you're becoming independent. That's what really defines that. So you're educated, okay? You've learned about what you need to do to take care of yourself. You've learned about what's a healthy diet for you based on where your health is at and based on where your genetics is at. You've learned what the best type of exercises is for you, for your goals and for your muscle type and in your DNA, your genetics there. Your attitude is in a good place. You have a good way of looking at the world, and you're getting adequate rest. Okay, so those are the three. That's the least expensive. So the most expensive is the crisis care. The active care is in the middle, kind of, because you're paying for appointments to see people. And then wellness care is that independent. So you're just, it's you taking care of yourself, which is going to be the least expensive of any of the options. I want to talk about chronic disease a little bit. An alarming escalation in the number of people who suffer from chronic disease, right? Cancer, diabetes, heart disease, Alzheimer's, autoimmune disease, so on and so forth. Chronic disease in America is up from 4% in 1965 to 60% today. And this was before the pandemic. So these were numbers that came before all of this, and I think that most of us can assume that it's only going to get worse. The allopathic system, which is what we have in our healthcare system today, is great for acute symptom care for an injury or illness for a short duration, like an appendicitis or a fracture or an infection, that kind of acute trauma kind of thing. But that is where we see less than 10% of healthcare actually falls into that category. In those kinds of cases, doctors prescribe treatments like medications and surgery, which aim to treat the immediate symptoms. Unfortunately, the acute care lacks the approach, it lacks the methodology and the tools needed for treating more complex and chronic disease. So we have to change our long overdue, changes are long overdue to our way of thinking. Okay, so popping a pill is a Band-Aid for a short time cure, right? There's no cures. You think if there's magic pills, we would have found them a long time ago, right? But we're going to never stop looking for them. I get it. I'd love it if there was a magic pill too. You think your doctor's job is to fix your symptoms when problems arise. Okay, this is another way of thinking we need to stop. Your physical activity is reduced because this is what happens as you age. Anybody who tells you that you should do things differently or that your health problem is because of your age, I would just walk out of the office and go find another doctor. Okay, because I don't want to be treated differently just because I'm older. Okay, I'm still going to be here a while. I still want to enjoy my quality of life, and I don't want to get any less kind of treatment or advice to go and take care of this problem just because I'm on the other side of 60 or 70 or whatever the case is. The other thing is when your doctor tells you it's not your fault, it's your genetics. Okay, so that's another thing. We were taught that our genetics determine our health, and that is the huge myth that has been totally shattered by something called epigenetics that I've talked about previously. So I'm not going to go into that today. So there's previous podcasts on that if you want to go back and listen. So I want to talk a little bit about wellness. Wellness is an evolution in healthcare practice. It better addresses the needs of what our health concerns are for the 21st century. Okay, back in 100 years ago, we had a lot more acute problems. That's not the case today. Today we have far more of the chronic problems. So we need to make a shift away from the traditional kind of sickness and disease-centered focus of medical practice to a more patient-centered approach. Okay, and wellness addresses the whole person, not just symptoms. We need to spend time with patient. We need to listen to them, understand what their health history is, look at their interactions among their genetics and their environment and their lifestyle factors that all influence our long-term health and our chronic disease, risk for chronic disease. The hallmarks of wellness are in understanding the origins and prevention of chronic disease. It's a patient-centered approach, as I mentioned earlier, that promotes health as a positive, kind of vital, we want a kind of way of living beyond just the absence of disease. It deals with the underlying cause of sickness, and it's also a partnership between coach and client. In our clinic, I never use the word patient. I do not like the word patient. It just it's basically a person who is a bystander in their health. They're just passive. Okay, in wellness, you are a partner. Okay, with your doctor, your actions are going to determine your results. Okay, so it really needs to be a partnership. And in fact, you're the more important partner in this relationship. Okay, because you spend all your time with you. you're with you 24/7. So your doctors can guide you and do the right tests for you, so that they can give you, here's what you need to do. Here's a plan. Here's a system that you can follow to get the results that you're looking for. But at the end of the day, it's going to be your actions that determine your results. So accountability is important. Wellness method works with conventional medicine okay, wherever possible, okay, because one approach cannot serve everyone's needs. Sometimes we're going to need that acute care. Sometimes we're going to need that trauma care, okay? Life, you never know what life is going to throw our way. But the problem is when we depend on the acute care for chronic problems. So there's four main reasons why people choose a wellness approach, okay, or holistic, and that is to resolve health conditions, not just treat symptoms. It's to prevent sickness and disease. It's to learn to align their lifestyle with their genetic potential and how that interacts with the environment around them. Those are the three keys that determine health, okay, your genetics, your lifestyle, and your environment around you. All of those things have to be looked at, and that's basically how to set up a plan for your health, okay, that's going to get success 100% of the time, okay? And this is going to allow your bodies to work at an optimal maximum efficiency. The healthcare system is outdated, okay? There's a huge gap between scientific research and our healthcare system. Research in basic sciences and integration into medical practice is as much as 50 years out of date, particularly in that area of chronic disease that I was talking about. Conventional healthcare does not consider the unique genetic makeup of the individual, you, or the factors like environment, toxins, and the modern fast-paced lifestyle that influences sickness and disease today. Biohacker podcasters, I can get more scientifically relevant information from them than most doctors. Seriously, they are far more ahead, far more cutting edge than 90, I would say probably between 80 and 90% of the doctors that I talk to. Most doctors are not trained to assess, and I'm talking medically trained doctors here, to assess the underlying cause of disease and even apply basic diet, nutrition, and exercise to prevent and treat illness. And most are happy to admit that. They don't get a one nutrition class in medical school in any of the medical schools in America. That's a pretty sad reality, I think. So we need a science-based approach. So the problem with when you move into wellness, people think, oh, now you're not following science. Well, you actually are. You're just following more updated science. So that's why there can seem like there's a lot of conflict. In the wellness method, we look upstream to consider that complex web of interactions in the patient's biology, their medical history, their lifestyle, all that caused and created illness. Their unique genetic makeup is also considered, along with their body, mind, spirit, right? That triune of life that I talked about earlier, those three intelligences, okay, as well as in how it interacts with our physical and social environment. All of this comes together to affect your total function. So we want to integrate all the best practices. So traditional Western medicine, it's the finest in the world for dealing with acute care, such as the diagnosis and treatment of trauma or short duration illnesses in need of urgent care. Okay, we don't want to we need that. I'm so glad when we have it, when I need it. Fortunately, knock on wood, I won't anytime. But for chronic disease, which is 90% of healthcare, we need another way of looking at things. And that's precision healthcare. A big problem with our healthcare is that it's very generic. Okay, if you get a certain lab test result, it doesn't matter. Nothing else is really considered about you as a person, except for that lab test result. And so this is the treatment you're going to get. Okay, wellness medicine. In here at the Wellness Method, we integrate conventional medicine with a focus on prevention through coaching, health coaching, education, nutrition, detoxification, genetics, and exercise. We want to use cutting edge blood tests along with DNA and other diagnostic techniques to prescribe therapeutic diets, anti-inflammatory programs, hormone programs, exercise, and micronutrients, all of this personalized for you based on your test results. And wellness keeps you from being a high risk for disease. And we've heard that term high risk a lot in the last year, because when you have another disease condition, you're at high risk for COVID, right? You fall into that percent of people that they need to really be concerned. Okay. Luckily, it's a small percent, but it's actually, when I think about it, it's actually a large percent, because 60% of our country has got a chronic disease. So that's a pretty high percent of people. It's actually more people than people who are healthy. So we want to avoid being in that high risk category. But if you already happen to be in that risk, you can still turn it around. Okay, so you can start reversing that that damage that has been acquired through years of stress by enabling your body to heal itself. This is very different from treating symptoms with medications and surgery. So who qualifies for this type of proactive approach? Well, here's the catch. You have to qualify yourself. So when I have people come in to see me, we go through a very extensive interview process to make sure we're a good fit to work together. So they're interviewing me, I'm interviewing them. And if it's not going to be a good fit, then the relationship's not going to work. You're not going to get the results. Nobody's going to win. So there's no point in even going down that road. Okay. I've been doing this 25 years. I know how it's going to end, right? It's going to get all toxic at the end. There's going to be blaming and finger pointing. And I don't even want to go down that road, because what's the point, right? It's not worth that paycheck to me, for that person to just walk away unhappy. They're going to be all stressed and unhappy. I'm going to be unhappy, because they're, it's just, there's nothing good that comes from it. So you need to get yourself to a place where you're ready to do something. You need to take care of this matter. And if you're struggling or suffering with a disease process now, then you need to get on that. There's what are you waiting for, right? Okay. There's so many reasons. And if this last year in especially 2020, in the onset of coronavirus, if that hasn't brought it into focus for you, how important it is to stay healthy and be healthy, then I don't know what will. We talk a lot these days about, making sure that you're doing your part to keep other people healthy and to keep them from being at risk. All right. So this is, I think, the most important thing that you can do. If you can get yourself healthy, then you're not going to be affected. You're going to be there. You're going to be healthy for your kids. You're going to be healthy for your family, and you're going to be there when they need you. So too many people fall victim to this harmful pattern of hoping that things are going to get better rather than acting. And hope doesn't have a good track record for preventing disease. So what harmful patterns are you holding on to? That's what I want to just leave you with, that question for today. And I'll look forward to talking to you guys next time. All right. Take care, everybody.